Hello, welcome to Stateline. I'm Josephine Cafagna. Supervised drug injecting rooms save lives and help rehabilitate drug users, according to new research by the Burnett Institute. To be released next week, the findings will be used by health workers to propose the first mobile supervised injecting facility for Melbourne. But the suggestion is bound to strike hurdles as the political parties home in on the issue of law and order in the lead up to this year's state election. Cheryl Hall has more.
It's very important that if someone's injecting, that they're using a new syringe every single time. You can see we've got all the same injecting equipment. All of this is available for free.
So would this operate in a similar way to the mobile safe injecting service that is being proposed?
With some differences. Obviously, if there was a mobile injecting facility, it would need to be more like a bus, because it would need to have a space for someone to come into and be able to inject in a supervised space.
Victoria supported and then abandoned the idea of supervised injecting rooms nearly a decade ago. But the debate is about to begin again. The Yarra Drug and Health Forum in Collingwood has run a mobile needle and syringe exchange for 10 years, but now it wants to start the first supervised injecting facility in Victoria in a mobile van.
It would have maybe 1 or 2 booths where people could inject, and they would have obviously nursing staff there who are qualified and know what they're doing, making sure to some extent that the people, they wouldn't actually be doing the injecting, that doesn't happen, but making sure that the person is injecting properly and safely.
The Yarra Drug and Health Forum has commissioned a report by medical research organisation, the Burnett Institute.
The Burnett Institute, our currency is evidence, it's not opinion, and we were very prepared to take on an objective review of the evidence. And as I've said, there's very strong evidence to show that it's probably a time to reflect again.
In a report to be released next week, the Burnett Institute looked at evidence from 76 supervised injection facilities now operating around the world. It found them to be a pragmatic response that not only reduces the health risks for drug users and improves their chance of getting further treatment, but also improved public amenity.
You're getting drug injectors off the streets. I mean, one of the biggest problems for the community is disposal of syringes, discarded syringes in the streets, drug users injecting in public places. People who are attracted to those services are often those who are at highest risk. They're often homeless. They're often involved in sex work. So, and most importantly, and this comes from the data from the Sydney facility, 3/4 of all those drug injectors have not yet contacted another service.
But the biggest benefit of supervised injecting facilities is fewer deaths from overdoses.
With 3,500 drug overdoses successfully treated on site, we know that a proportion of those certainly would have died were the immediate medical assistance of this service not available. And so these are people who would never then have had the opportunity to go into rehabilitation.
Australia's only medically supervised injecting facility in Sydney's King's Cross was part of the Burnett Institute study. 200 people use it every day, or 12,000 in the last 10 years. 70% were referred on for treatment.
I think some people have perhaps a simplistic view that really you just need to meet with these people and refer them into drug treatment and somehow everything will magically be okay. And I think you only have to think about that for a moment or two to acknowledge that however much we might hope for that to happen, it doesn't. And there's no facility of any kind anywhere in the world that's been able to produce some kind of magic bullet.
In Melbourne, the Yarra Drug and Health Forum says there's a similar problem.
We're not talking about putting, supervised injecting facility in every suburb. We're talking about particular places. I mean, we're talking probably about the city of Yarra, mainly Richmond, Collingwood, Fitzroy. We're talking about Footscray, obviously Dandenong, St Kilda. And they're the main. I mean, people actually at the moment from other suburbs come into those suburbs to get their drugs and then to use, and that's why they're using, a lot of them are using on the street.
It's a claim supported by the Burnett Institute's research.
Another important study that we conducted was looking at the last incident of injecting in Melbourne of a sample of drug injectors, and it was really apposite to note that more than 65% of those drug injectors injected in a public place, and that would include things like a public toilet, a car, the streets, and in stairwells of buildings.
In 2000, then Premier Jeff Kennett supported the introduction of supervised injecting facilities in Victoria, and so did the newly elected Bracks government. Both parties abandoned the idea soon after and remain opposed.
Our position on this has been very clear for some time, and I don't intend to revisit the issue.
On that issue, the Liberal Party agrees. The only politicians willing to risk public disapproval now are the Greens, who need only a small swing to take 2 inner Melbourne state seats and 2 federal seats in the elections later this year.
I think people are ready to look at this issue again. It's an important one. People are dying all the time because we don't take a sensible approach to drugs policy.
But the Greens' opponent for the Victorian Senate seat, Family First Steve Fielding, strongly opposes supervised injecting facilities.
It's sending the wrong signals to the community about that it's okay to take illegal drugs. It's not okay to take illegal drugs, and we should be doing more to prevent it rather than actually sort of saying, there, keep on taking them.
The Burnett Institute's research found no evidence the supervised injecting rooms increased drug use.
In fact, the opposite. What tends to happen with supervised injecting facilities is people get direct access to treatment because there are health professionals on site.
It's just crazy. The next thing we're going to hear is that we're going to have a mobile injecting room that people can just walk in and walk out in their neighbourhood.
The debate is so sensitive that after 10 years of operating in Sydney, King's Cross's medically supervised injecting facility is still officially on trial. No politician has instigated legislation to make it permanent, despite support from local businesses and residents.
They know what would happen if this service wasn't available. They know that the drug users would be back out on the streets. They know that the drug overdoses would be occurring on the streets. They know that the wails of sirens would go back to 3 or 4 times a day instead of once, maybe twice a week. They know what it was like beforehand, and they're very happy with the changes that we've seen in King's Cross.
With law and order shaping up as an election issue in Victoria, both Labor and Liberal are expected to attack the Greens' drugs policy. But the Burnett Institute is urging the decision makers to look at the evidence.
I think the evidence has changed, and as I say, from our perspective, we're providing the evidence. It's up to others to decide whether that would change attitudes.
Cheryl Hall with that story.